When disaster strikes, communities are tested, homes are lost, livelihoods disrupted, families displaced. But for many persons with disabilities, disaster does not begin when the floods arrive. It begins much earlier, in systems that were never designed to include them, in barriers to information, and in preparedness efforts that too often leave them behind. Across southern Africa, climate shocks and disasters continue to expose the inequalities that already exist. For many persons with disabilities, disasters do not only reveal vulnerability, they amplify exclusion. Yet one question remains urgent. What becomes possible when preparedness is truly inclusive? To understand why this shift matters, we turn to a voice that has witnessed both the barriers and the possibilities of disability-inclusive disaster risk reduction. Ms. Benthati Chikoet-Sila reflects on why inclusion is not simply an aspiration for disaster preparedness, but the foundation upon which resilient communities are built.
Across the Southern Africa region, disasters are becoming more common and more destructive. But for persons with disabilities, the greatest challenges do not start when disasters strike. They stem from long-standing barriers to information services, infrastructure, and decision-making that leave them disproportionately exposed to risk. Inclusion is therefore not an option in disaster preparedness and response. It is a fundamental requirement for effective, equitable, and resilient communities. When persons with disabilities are included in disaster risk reduction efforts, early warning systems become more accessible, preparedness measures become more responsive to diverse needs, and emergency responses reach those who are often at greatest risk. Excluding persons with disabilities can leave critical gaps in planning and response, increasing vulnerability and preventing entire communities from achieving resilience. By ensuring meaningful participation in decision-making, planning, and implementation, disaster risk reduction becomes more effective. It upholds human dignity and rights, and also ensures that no one is left behind when disasters strike. The DIDRR project was a regional initiative which started in 2022 across Malawi, Zimbabwe, and Zambia, supported by CBM in partnership with BMZ.
Building on this reflection, Ms. Chikoet-Sila shares insights into a regional initiative that translated this vision into action.
The initiative focused on strengthening the capacities of organizations of persons with disabilities, government institutions, and other key stakeholders to effectively integrate disability inclusion into disaster risk reduction policies, programs, and practices. This initiative also promoted the meaningful participation of persons with disabilities at all levels of decision-making, creating opportunities for their voices, experiences, and expertise to inform preparedness, response, and recovery efforts. This was achieved through participation in regional conferences, targeted training on disaster risk reduction, such as policy analysis and advocacy strategies. Recognizing the value of collaboration and shared learning, the initiative also facilitated peer-to-peer exchanges and knowledge-sharing platforms that brought together stakeholders from across participating countries. These engagements enabled communities, practitioners, and OPDs to exchange experiences, showcase promising practices, and strengthen regional cooperation on disability-inclusive disaster risk reduction. To further enhance resilience at the community level, the initiative supported economic empowerment interventions aimed at reducing vulnerability and strengthening livelihoods. This included demonstration plots, livestock rearing initiatives, and village savings and loan groups, which provided practical opportunities for persons with disabilities and their households to build economic security and better withstand the impacts of disasters and climate-related shocks. Through these interconnected interventions, the initiative contributed to stronger institutions, more inclusive participation, enhanced regional collaboration, and improved community resilience, demonstrating that disaster risk reduction is most effective when persons with disabilities are recognized as agents of change rather than just passive beneficiaries. In addition, the initiative captured and documented best practices, lessons learned, and recommendations, creating a valuable knowledge base for future disability-inclusive disaster risk reduction efforts. As this documentary continues, we explore some of these experiences and insights, highlighting the approaches that have shown promise in building more inclusive and resilient communities.
Resilient livelihood, diversification. For many persons with disabilities, climate disasters do more than destroy crops. They threaten livelihoods and independence. To address this, communities in Zambia and Zimbabwe embraced climate-smart agriculture, savings groups, and small business financing. Through accessible farming training, drought-resistant crops, and community savings and lending schemes, people with disabilities gain new ways to earn income and recover from climate shocks. These initiatives reduced dependence on rain-fed agriculture and strengthened household resilience. The result is more than economic security, it is empowerment, proving that with the right opportunities, vulnerable communities can move from surviving disasters to thriving beyond them. Meaningful representation. Disability inclusion becomes truly effective when persons with disabilities are not just beneficiaries, but decision makers. In Zambia and Zimbabwe, people with disabilities were integrated into disaster risk committees, helping design early warning systems, evacuation plans, and recovery strategies. Their lived experiences transformed disaster preparedness, making communities safer, more accessible, and more resilient. This shift proves a powerful principle. Effective disaster risk reduction is only possible when everyone has a seat at the table. As the Zimbabwean saying goes, love yourself, stand for your rights, and speak for yourself. Inclusive early warning systems and accessible evacuation. In a disaster, a warning only works if everyone can receive it. In Zambia and Zimbabwe, inclusive early warning systems were designed to ensure that no one was left behind. Using sign language, visual alerts, accessible communication, and community-based warning networks, life-saving information reached people with different disabilities. Accessible evacuation routes, trained responders, and inclusive shelters further ensured safety and dignity during emergencies. This initiative proved that disaster resilience is strongest when preparedness is built around the needs of all community members. By combining local knowledge, accessible technology, and inclusive planning, persons with disabilities became active participants in protecting their communities. Community-led geospatial mapping of persons with disabilities. Before disaster strikes, knowing who is at risk and where they are can save lives. In Zambia and Zimbabwe, communities led by persons with disabilities mapped vulnerable households using geospatial technology and local knowledge. This data revealed that many persons with disabilities lived in high-risk flood zones and often remained invisible in traditional disaster planning. By identifying their locations and specific support needs, emergency teams could plan targeted evacuations, position resources more effectively and provide faster assistance during crises. The initiative transformed disaster management from reactive response to proactive protection. Its message is simple yet powerful. If you are not counted, you cannot be accounted for. The true impact of this initiative is not found in reports or statistics, but in the lives of the people it touched. Through their own voices, beneficiaries share stories of resilience, inclusion, and hope, revealing what becomes possible when no one is left behind. Testimonies from project beneficiaries.
Ndinotenda nenguva yandawana kuti nditsanangurewo makoments angu andakasangana nezvandinoona mumakore andafamba ndiriwo muredziwo zvidzidzo zvataidzidzawo. Ndinofunga upenyu hwangu inini ndatobhenge ndiri munhu aitozvishandira zvese zvichiita mune zvakanaka. Pane kondisheni yakazongonditonherawo yandiwira kudaro kondisheni ndanga ndane nguva kufunga ndichitambudzika neupenyu zvokuti ndaiva munhu aigara ari nekunyara kune vamwe vangu kuti andosvika sei unofanana ndisvike pandenge ndichida kuenda. Zvaindishungurudza mupfungwa semunhu akakura achizvishandira zvakanaka. Zvadaro ndakazosanganidzwa nawo nepurogiramu yereps
neDRR. Hazvida kunetsa here, ndinoti hazvida kunetsa nokuti ava vakaintrodusa DIDRR vakatanga kutrena vanhu vari disabled. Vatrainwa vari disabled, takakwanisa kuzojoiniswa manje kuti imimike nevava mamunhu mumwe chete. We expect you to help these people kana vakuita misangano yenyu. Everything that you do itai pamwe chete kuitira kuti munonzwawo maviews evakaremara kuti vanodawo zvipi, kwete kuvaitira kana kuvarongera. Rongai pamwe chete. Saka in such a way hatina kuzombonetsekanaba, takangojoinana tikabva tabatana tichiita zvinhu zviri pamwe chete. There was no problem.
Tine kumwe kutarisira kwatakaronga kuripo kusana yakondora kudenga sikupera kudenga basa. Tiri kufungura migodi yatinge tichishandisa irrigation nemasola kuitira kuti zvinhu zvedu zvifambe zvakadini zvakanaka. Tinoti tikasangana tine irrigation yatinge tichidi futi tichiita.
Vanhu vari kuchigo then vari kamanjenye kuliswa ngenyantuku. So kuti na project ya phasing tatukoyima vokamuka kuti ya phasing mukuti twakaiya sebo tulazumana na a project yasu then twajana ziyachitusipede titujane muli nandu iyo muna ni benefit twena muya twaita spend twaja tetuyanda kusika point project ndialuganda kuti tatukoyima twazwitira paga vakusike mpoint yandika
ngatukunga tukuwala bo kwanjira wabupa ili abantwana batupa iko ni akapatiwo wala sipa
to even at least facilitate their child to get into school. But after this project and whatever we learned through the proceeds from the gardens, we are now able to even take our children to schools, others even in colleges. Thank you so much. I'll end here from me.
As a pilot initiative, the DIDRR project provided an important opportunity to test, learn, and refine approaches to inclusive disaster risk reduction across different contexts in Southern Africa. Working across multiple countries and partners, the project revealed both progress and practical challenges in translating inclusion into action on the ground. One of the key challenges was the limited availability of disability disaggregated data within existing disaster risk reduction systems. This meant that Inclusive planning often had to be developed iteratively while simultaneously strengthening the evidence base. Accessibility also remained an important consideration throughout implementation, from communication methods to participation in community spaces, requiring continuous adjustments to ensure meaningful inclusion. At community level, understanding of disability inclusion in disaster risk reduction varied. In some areas, acceptance and uptake were strong, while in others, it required ongoing engagement, dialogue, and capacity strengthening to shift established practices. Coordination across multiple actors, including government structures, OPDs, and implementing partners, also required time and alignment, particularly in a pilot context where systems and approaches were being tested and refined. However, these challenges were not setbacks. They formed part of the learning process that is inherent in pilot programming, where innovation and adaptation go hand in hand. Most importantly, the pilot demonstrated a key lesson that inclusive disaster risk reduction must be intentionally designed from the start and strengthened continuously through practice, learning, and partnership. And it is from these lessons that future programming can be scaled, improved, and sustained across the region.
A very good visit at the district. Then we came into the field. I think for me one of the key things which usually is at the core of projects is the aspect of ownership. Okay. So ownership will either build the project or kill the initiatives. Okay. But this project has demonstrated a very high level ownership at all levels, very critical. So for me, that is one key takeaway. And if we look at future initiatives and interventions, I think that's one lesson that we should pick, how we have managed here to instill this sense of ownership at every level, including the beneficiaries themselves and also the highest level of government. And secondly, the other aspect, I think it's also the self-drive within the communities themselves, because there are things that they were able to do by themselves without waiting for REPSI to come, without waiting for the project to come and say, oh, can you do this? They noted the challenges and they were able to come up with their own solutions. And homegrown solutions are the ones that actually sustain these initiatives. And thirdly, the other aspect is also the civic leaders. I want to talk about civic leaders because I see how sometimes civic leaders would make implementation a challenge. But here I have seen a plus, because civic leaders, where we come from, the more they are involved in the project, the more you have problems sometimes, because they tend to influence what you do politically. Yes. But what I have learned here is that the civic leaders have been very neutral. They have been focused on development and not politics. And I think I want to applaud that, because in Zambia you would find you have civic leaders participating in the project, but then at some point they begin to bulldoze the project with political agendas. But here I have observed a high level of neutrality from the civic leaders, which is a plus. And I think this is what we need in projects, because we can't implement these projects without civic leaders. Civic leaders are there to steer development. That's why we put them into power, because they are there to steer the development agenda. So we expect that they are always neutral. And for the case of Zimbabwe, I think it's a plus, because they have demonstrated that it's possible to be a politician, a civic leader, but still deliver the development agenda and benefit the entire community.
Wow.
I wouldn't want to interview first, just saying already. Yeah, so personally, I think I've learned a lot. Starting with where we were yesterday, when you look at how the the DRR cooperative to be JDRR. So I think that's a very big lesson for us on how we were supposed to start the other side. Yeah, so we've learned from here. Now I wish we had learned that the other time maybe we would have implemented, but we learned it at the end of the project. But still, it's not bad. There are other projects we are still implementing as that, so we're able to learn. And yes, and then looking at the testimonies, the people are giving of persons with disabilities, how at one point they are unable to socialize, and now they are able to socialize this time around. Yeah, so that's a big lesson as well. And for sure, from the way they are giving these testimonies, even if reps is to be off this word for some time, I'm sure it won't end. They'll pick it up. Yeah, so just from their testimony, they said, oh, me, see how I was. Now this is where I am. Yeah. So, many of the times I think as human beings, we learn well sometimes from our friends. Yeah, the facilitator may come, we may not pick it up very well. But when we learn how this one has implemented, for sure it will make an impact that I'll also be able to. Then the other thing I'm looking at, this is more like, I don't know, can I say, it's not a desert, but it's like, it's a kind of dry.
Low veld.
Yes. Then I heard a testimony where they're like, time comes when tribes come here to ferry vegetables to the market. So, when you just visit, like I didn't visit any garden, I would doubt, I said, no, you can't get vegetables here. I have to go maybe the other side to buy vegetables. So, they are, when it comes to issues of climate change, they said, no, we can't see, because this is a dry area, we can't grow that, no. Because as long as there are people who live here, we have to do the farming just like another person elsewhere. Yeah, so this is a very good lesson for us as well. Otherwise, thank you so much. And when I look at the stakeholders, you're one of the stakeholders for the project. Yeah, the way you're taking the project, and not just the meteorological department, education, social welfare. We've got a lot to learn as Zambians, yes, actually. Oh, how I wish we had brought a government person here as well. So that they would have gotten something. Otherwise, thank you so much. So thank you so much, Zimbabwe.
The meteorological information and such. We actually used to have two categories of takers of the met information. But surprisingly, it's now the same. Because we had the urban ones, because they had the televisions, radios, and they would receive that information when it is just being disseminated. Then surprisingly, when I was attending these two events, I discovered it's now almost the same. Yes, now almost the same.
This project also had a component of climate change adaptation. Yes. And one thing that excited me today in this particular meeting was the fact that the councillor mentioned something to do with climate change adaptation. When he said that REPS has left us with knowledge that when we are constructing our houses, we should ensure we are not building on flatland. I was impressed to say, if you see the local leadership grasping projects to such an extent, it means that the community will be safe. Because if he remains with that knowledge, he's going to pass it on to his constituents, and he's going to ensure that people are building on places that are safe for them in the event of floods. So thank you so much. The community has received the project very well, and it's very exciting. You could tell even from their level of disappointment that the project is now coming to an end. That shows that the momentum has been built very well by REPS and FODPs, and the work that they have done on behalf of CBM is really, really impactful in this moment. So thank you so much.
I just want to appreciate the linkage or the realization that when we do disability inclusion or when we do climate change, this should be mainstreamed. We mainstream disability inclusion in climate action. We mainstream climate action in disability inclusion. Issues of accessibility. Yesterday, they were talking about solarized water pumps to make sure that even those persons with disabilities may be able to fetch water from the taps, potable water. Those are issues of accessibility. And also today, the women, they are saying they are now buying gas stoves and they are now cooking using gas stoves, and it means they are running away from deforestation, and they are now becoming climate smart. So it means that even when we look at issues of accessibility, a person with disability, it's more user-friendly to use a gas stove than maybe making fire. Fetching firewood and making fire, it's quite hectic, but it's more easier to use gas stove. So I like that mainstreaming part.
From a point of view where I haven't been part of the project, as an observer coming from outside, I know people like Rumbidzai, they've been coming here for supervision, although they are based in Harare and so forth. So they might be biased. But for me, I'm just coming here with a neutral view. First and foremost, the day before yesterday, we were in Centenary, and the whole conference room was full with stakeholders, very passionate about the project. And I thought it was going to end there. But as we were now going yesterday to the other award, Jarekera, I was surprised to see the faces I had seen the previous day in Centenary. I thought, like in other countries, which I will not mention, you call stakeholders at maybe provincial or district level, they come, they end there. But when it comes to the actual field work, you rarely see them. And that is a plus for the stakeholders. So it's not about coming for meetings, but it's literally going out there and talking. And I was observing the way they were interacting with the beneficiaries. It's not like they are seeing them for the first time. It was like they are part and parcel of the community. So that is a plus in terms of buy-in. Then the second aspect is the issue of the project design. When I looked at the issues of assistive devices, in the project design, that was not part of the component. Just looking at the literature as I was reviewing, and that has also been alluded to by people I interviewed. But when REPS realized that there is a component, a financial component, which is still remaining, they then said, instead of returning the money, or instead of continuing to do what we have been doing, which is part and parcel of what we designed for, let's invest in the assistive devices. And what really touched me was what Rumbidzai and the CD for REPS said, that with assistive devices, we are promoting dignity. Once you promote dignity, you are also helping issues pertaining to mental health. And once that is done, then the persons with a disability, they reach their full potential. And that's what is expected, that's what is needed. And like somebody was saying, you can provide a plot, a demo plot, which we saw yesterday. But if that person, and I think it has also been said here, if that person does not have a wheelchair, how do you expect that person to go? So REPSI has gone beyond the nature of the project to ensure that component. So it's a big lesson for whoever wants to replicate this. I don't know in Zambia whether assistive devices were part of the project initially.
They were not.
They were not.
But the project document is the same.
Is it the same? Yes. So this is a plus. So it's about thinking outside the box. You look at the community, you see their needs. And I think all developmental projects, if they can take that into consideration, that will really help. Then policy. one thing which I realized was that whilst the country has got a national policy in terms of disability, but the district realized that they didn't have a policy, and they thought the policy at national level was not going to really fully assist them. So based on the project, as they were reviewing the project, they've realized the need to have a policy which is going to promote issues of including persons with a disability into the entire set of pillars within the district, which is also a plus. So a project should not just be there to support that particular community, but we should make sure that it influences, the policies, the laws, so that at least other people who have not been exposed to that intervention can also learn.
As this documentary draws to a close, we extend our sincere gratitude to persons with disabilities, communities, implementing partners, government stakeholders, community leaders, and technical experts whose experiences, commitment, and collaboration made this journey possible. We also acknowledge the invaluable support of CBM and BMZ, whose partnership and investment enabled this regional initiative and strengthened efforts towards disability-inclusive disaster risk reduction across the region. The stories, experiences, and lessons shared throughout this journey remind us that inclusive resilience is not built in isolation. It is strengthened through participation, partnership, and commitment. The progress made through this initiative has deepened our understanding of what disability-inclusive disaster risk reduction can achieve in practice, while also highlighting opportunities for continued learning and improvement. As we reflect on this journey, the lessons learned and recommendations to follow offer important guidance for strengthening inclusive resilience and ensuring that no one is left behind. Inclusion must be intentional from the start. Disaster risk reduction is most effective when persons with disabilities are included in planning, response, and decision-making from the beginning. Data matters because visibility matters. Limited disability disaggregated data revealed the urgent need for stronger systems, including the use of Washington Group questions to guide inclusive planning. Accessibility cannot be an afterthought. Emergency communication and response systems must reach everyone through visual, auditory, SMS, sign language, and other accessible formats. Communities are the foundation of resilience. Village-level support systems, buddy networks, inclusive disaster committees, and savings groups strengthen preparedness and collective protection. Representation drives meaningful inclusion. Governments and local structures must create permanent spaces for organizations of persons with disabilities in planning and governance processes. Capacity building must be continuous. Regional learning platforms and Center of Excellence can sustain knowledge, strengthen coordination, and improve inclusive disaster preparedness over time. Service delivery must anticipate need. Preparedness requires pre-positioning assistive devices, accessible services, and livelihood support tailored to different disability needs. Long-term investment creates lasting resilience. Donors play a critical role by investing beyond short-term aid, supporting inclusive systems, community resilience, and regional learning.
The DIDRR pilot leaves behind one enduring lesson. Inclusion cannot be an afterthought. When intentionally designed from the start, disaster risk reduction becomes stronger, more responsive, and ensures that no one is left behind.